Vrat, etc. Definitely there is role of telecommunication, as we are seeing telemedicine, teletreatment, various fields have been emerged. So thank you very much for joining. We would like to welcome you all on our 2403rd milestone, Independent Research Ethics Society AYUSH Samriddhi International Webinar Series, Telecommunication for Treatment. On May 17, World Telecommunication and Information Society Day both have been celebrated, and today we are fortunate enough to celebrate it on 19th of May. So thank you very much for joining. All YouTube viewers, thanks for watching. I would like to communicate my regards to Dr. Suparna Sanyal Mukherjee Madam. Welcome, Madam, from Bolpur, West Bengal, and Dr. Sakat Kumar Basu from Canada and West Bengal. Both are great speakers, and I don't want to interrupt you all between speakers and the audience. Thank you, Sakat ji. Thank you, Suparna ji. Welcome. Now I would like to welcome Suparna Sanyal Mukherjee Madam for her speech. Suparna ji, namaskar.
Namaste, namaste. Very good evening, and thank you very much for this good and auspicious topic. I really thankful to the AYUSH SAMRIDDHI platform who has given me such an opportunity on the telecommunication and healthcare or the telemedicines. It's very important part of the today's life. We are really suffering from so many difficulties, and the world is getting very difficult to us not to getting the proper information, proper benefit, whatever. So in this aspects, we can develop our telemedicines and the telemedicinal factors, which is very important for us because we have to explore ourselves and we have to make ourselves very positive in this so far as health is concerned. That's why the telemedicine and telecommunications, whatever, what is the term we may use. If we develop our telecommunication or the telemedicines or the telefactor, so especially the people, those who are living in the remote sensing areas, they are very interactive, or they may not get any facilities for this the telemedicines, but it is also applicable for the organized and the people those who are living in this factor important to get the proper benefits for these aspects, which enhance the collaboration between the health medicine, the telemedicine, which helps relationship as it gives the opportunity to give the more flexible by allowing it. So if we are staying problem for this internet. However, I again I interact with this connection, and that's why I am telling the telemedicine is a very good aspects of this present era. Means this modern era, the people are who are living in this new world, that is the developed world. So telemedicine is a part of our life which can give us the more protection sitting at home. So, in fact, which is very important, this what is the benefit we can derive from this telemedicine or telecommunication system? So, it is beneficial for the population access to care. So, those who are living in the deep inside the forest, there is no scope for going to this, the hospitals. There is no health center, and nearby. But the people, those who are suffering from, if the telecommunication system will be very good, and not only that the Android or iPhone is needed, but the simple phone, those who can provide, if the government can provide them, or the any NGOs or the any partners or any CSR funding can give them the little phone, simple phone, then they can communicate with the doctors at the same time. The medicinal parts or different apps also there. They can also avail to this communication system and improves the decision making abilities to help the health providers and improve the quality of patients care and enhances community to care. So telecommunication enhance the collaboration between different organizations. That means if we are sitting in this Bolpur and there is a maybe the some outlet like the Shuroka. Shuroka is a telecommunication system, and Shuroka had the cases, it has the center connect to this any center of the Suroka, whatever located. So Suroka can give you the proper protect process. And the basic person needs for information technology and need and part of the patient needs and the satisfaction. It is very vital for security from a security perspective. Telecommunication is one of the most crucial infrastructure for the information
Dr. Sakat ji, please support for communication. Dr. Sakat Basuji.
protection for, from natural disaster.
Your voice is not coming, madam. Sakat ji.
हाँ जी, आ रहा है, अभी वॉइस आ रहा है?
नहीं तो आपका आ रहा है, उनका नहीं आ रहा है।
नहीं नहीं, मेरा वॉइस आ रहा है। मैडम का वॉइस शायद कुछ कट हो गया वगैरह। ठीक है, मैं एक काम करता हूँ, टू सेव द टाइम आई गेट स्टार्टेड। अब मैडम कैन जॉइन लेटर ऑन, देन इट्स ओके। ठीक है,
ओके, थैंक यू
मैडम। वी कैन हियर यू नाउ। हाँ,
कैन यू
हेलो।
हियर मी नाउ?
यस यस, वी कैन हियर यू नाउ, प्लीज कंटिन्यू। वी कैन हियर यू नाउ।
So I'm the concluding now. So I can foster that the telecommunication or the telemedicine pattern of life is very important part of our health care system and medicine system, which is can foster the development of our life, at the same time the protection of the people at large, those who are living in the remote sensing area, at the same time the rural and semi-urban places, and whether there is no such type of medicinal pattern, this the hospitals, the healthcare system is absent. The telecom medicine system and telecommunication system is very important part of their life and livelihood systems. Thank you very much. Thanks for giving me such an opportunity to say something on this auspicious platform. Thank you very much.
Thank you. Thank you very much, madam. Thank you very much. Though voice was interrupted unwantedly due to technical glitch. Thank you. Thank you very much, madam. Now I would like to request Dr. Sakat Kumar Basuji. Sakat ji, namaskar. Welcome.
Namaskar, namaskar. Thank you, Sharma ji. Thank you very much. We had a little bit of problem technically to listen to madam, but I think she has already highlighted the most important points. I think telemedicine has now become quite popular. I mean, I'm talking about with respect to allopathic medication. There has been a lot of doctors who are practicing it, live demonstrations and stuff are getting in. But see, just like this kind of a technical problem that we have sometimes, like our internet in this country is not yet quite stable. And if it happens even in big cities, towns, municipalities, the quality of available net on the rural areas, remote areas is even worse. This is where I think there is a significant challenge where the government needs to work out on establishing more towers and stuff. Although I do understand that for any government, and we have belligerent neighbors who are looking for doing harm to India and Indians' interest, it is not so easy to put out towers in remote rural border areas. There are ramifications of that, but nonetheless, wherever it is possible and if they are safe, or transmissions lines could be established, if ham radios could be used and stuff, whatever that could be extended in remote rural areas, particularly for medicinal advices, consultancies to be given, and particularly in form of Ayush, could be so much beneficial. Why am I highlighting mostly on remote rural areas and stuff is because many of the plants and medication formulations that you may suggest are easily available. People are aware of those availability of these plants, whether they are consulting a veggie or an Ayurvedic practitioner or not formally, but this is in practice within the village communities and our social structure for has been a long time, more compared to the cities. As a result, if a consultancy and an advisory is provided to them over telephone, or a telecommunication mode is used, or through internet or through social media, whatever channels that could be used, or through a WhatsApp phone call or a video call, I think this has great potential particularly in the rural areas, because they are already used to it. They know where to get the plants, and because they have an exposure of using these plants and their formulations in some way or other in their rural medication form, this will be more acceptable, spread faster, and reach to the benefit of the rural areas at a much faster rate. So, particularly where there are not proper medical centers that we look for, these kind of establishments of these centers, particularly for our daily life course, like, every day we do not need surgical interventions. Every day we do not need like a very complicated operations or a detailed, medical diagnosis, extensive laboratory test. Most of our problems are sometimes, runny stomach, or having a cold or a headache, or a small injury, or falling apart, or like a injury that has a swollen leg or something like that. All these initials could be easily, through initial screening, could be treated through telemedicine. And because Ayurveda has such a long holistic impact and affordable and accessible for the people in these rural areas, this could be extensively used by extending this facility in the rural areas and looking at the level of success, how it is turning out. I think then it could be applied more in the municipality and the corporation areas across various states. Our population is huge. It is not always possible for the government or the NGOs who are operating in particular areas to provide the best actual medical services, particularly in cases where non-invasive treatments are needed, or protective medications is needed. Like, if there is a season change and stuff, the coughs and cold, if left untreated, usually leads to a long-term problem. Fevers in many rural areas, simple fevers, because they're untreated for quite some time, results in serious consequences down the line. But with this telemedication, where it is not possible for the doctors to easily reach or access, the consultancy and the advices could be easily communicated to the people. And particularly if this is done in the local vernacular languages or the dialects in which the people speak, it will even add to the success. People will think when they're talking to the doctor, if he or she is talking not only in Hindi or the regional local language, if they can speak even the dialect in which part of that particular area that are reaching, they will be even more acceptable, because those who are the patients will consider them to be even more by far reaching person. They feel the console, the doctor speaks their own language, and they will feel that he or she understands their problems much better. And the medication and the consultancy, either in written form, and sometimes if it is not possible to get it in written form, just relief wise vocal consultations, if it is in their dialects, if it is in their languages, will make it more easier, accessible, and appreciated by the people. And through this, I think over the vast stretches of rural India or vast stretches of forest landed areas, people living in remote rural areas, forest fringe areas, border areas, and stuff, where any form of this communication that could be extended by telecommunication, it includes everything, whether you are reaching by internet, whether you are reaching by phone, whether you are having access through the social media, whatever tools, chatbots, or other facilities that could be generated, it could have a significant impact. Sometimes, even if a particular individual home in remote areas do not have a personal mobile phones or a personal laptop, desktop, the gram panchayats in their center could have a better high-powered internet for the entire village community, sponsored through the state governments for providing and strengthening or empowering the village communities. Then people coming to those online clinic will have much better access. You may not be able to afford a phone individually in those areas, but if you have a community center available where people could come for their treatment, their cases are registered, documentations are taken, and if there are facilitators who are helping the patients to get those telemedication advices, particularly from the Ayush platform, it could be greatly beneficial. Many such centers may or may not have their stock medication. If available, if this could be handed to them, it will be great, like twice a month or thrice a month, if or once a month, if it is possible to transport the medications, various forms. Where I'm by Ayush platform, I am considering all, like Ayurveda, homeopathy, Unani, Siddha, whatever medication systems are available. If some of these medications are made available to this rural community medical center where a doctor is not being able to visit because of the remoteness, but after every 2 or 3 months, if the necessary common medications are provided in Ayush, depending on Ayush platform, and then if there is a compounder or someone who is trained in those medications, at least they can hand over the medication, help them in understanding what kind of medications to be taken. Then even the remote consultancy by a Ayush practitioner could have significant impact on this population. And through this, we could build a very strong network or a health network across the countries, particularly those that are poorly served, particularly where health centers are scanty, particularly in tribal areas, indigenous community areas, where the broken health system has not been operating, particularly in infringement areas where there have been political disturbances, professional doctors are not being able to visit. But at least if once a week or twice a week or thrice a week, an online presentation or a telephonic conversation with consultant Ayurvedic doctors or other Ayush platform doctors are made available to the patients in establishing these centers, I could see that it could have a health revolution in India by reaching out to those communities who are most deprived of our health facilities. They are still the citizens of the country, and it is the responsibility of the government in providing them some medical or health care to the best of their ability to reach even these remote areas. Ayush, therefore, over telemedication can work significantly and build up a strong network of healthcare systems across India. I think there is an immediate need of working towards this and establishing such health centers through which telecommunication or telemedicine could be prescribed from the Ayush platform. There is a need for the central, state, and the local panchayats to work together and coordinate it better so that it facilitates a greater side of our population and particularly reach those areas which are particularly ill developed or deprived of proper healthcare system. So it has huge potential. There needs to be ground survey, and wherever suitable places, 2 or 3 villages could be incorporated into one center of visiting center of nearby adjoining villages, and satellite dish, satellites, antennas, and better internet facilities at least could be established in one particular center, so that if you have a strong receiving center at one part, then 3 adjoining villages, patients can come from this, all these 3 stations or villages, and work for treatment, comes for telecommunication, telemedicine prescription, or telemedication consultation by Ayurvedic doctors at one center. So but even if every villages could not have integrated systems, bringing in coordination, 2 or 3 villages together in one community facility center where Ayush prescriptions are provided through telemedication, can have great significant impact on Indian healthcare system. I think the idea is great. It is being operated experimentally in some areas. If it is so successful in case of allopathic medication, it has huge opportunities, and it could expand even far beyond our expectation with respect to Ayush medication. So I congratulate the idea. I greatly feel that this has huge potential in changing the health sector of India. And thanks to Dr. Sharma and the IRES platform for providing this important, engaging discussion on such new technologies and ideas that could help in changing the health scenario of India. Thank you very much, Dr. Sharma. I conclude my presentation here, and thanks for giving me this opportunity.
Thank you. Thank you very much, Chakaji. Tomorrow
You're most
10:30. Tomorrow 10:30. B day. Tomorrow is B day.
Yes, I'll be available. No problem.
Thank you.
It
Thank
is
you.
my day. I will be available entire evening.
Thank you.
Surely will be available. No
Thank
problem.
you. Thank you.
Thank you. Thank you.
डॉक्टर सीपी शर्मा सर हैं क्या? डॉक्टर सीपी शर्मा जी, I hope he is today busy, but he is with us right from the beginning. So thank you very much for joining.